Let's talk perimenopause and sleep problems that can happen during these times. Perimenopause, hopefully you know, if you don't know, I'm going to tell you right now, is that period of time that is about 10 years or so before your period actually has stopped for a year. That's menopause. But just because you haven't gone through actual menopause yet does not mean that there are not symptoms and bothersome symptoms, concerning symptoms that happen along with this perimenopausal time period. One of my uh, real annoyances is that this time period, up until very recently, which and it's getting better, has been really ignored and mistreated. And a lot of women have been kind of medically gaslit, I guess you could say. I feel like the word is spreading now, and I'm really encouraged by it. If you have ever had a poor night of sleep, you know that a poor night of sleep leads to a poor next day, and sometimes longer than that. Sleep really has an impact on our quality of life, both immediate and long term. When hormones start to fluctuate during this perimenopausal time, particularly estrogen and progesterone, that really can mess with our sleep. And not only does progesterone and estrogen fluctuate, also cortisol then can start to fluctuate, and those ups and downs can really wreak havoc on our sleep. What often ends up happening is that when we get frustrated about our sleep, then we're really not going to fall asleep. And so that's when we go to our doctor, our nurse practitioner, our provider, and we say, here's what's going on. And they give us a sleeping pill and an antidepressant, which may work for a period of time, but really does not get to the root of what is going on. Certainly doesn't help you in other ways like hormones would. In addition to these sleeping problems that can happen, there are so many other symptoms happening during perimenopause that when we use the proper hormones or supplements or lifestyle changes, not only do we get rid of the hormone imbalances, the problems, but then we also end up solving so many other problems that maybe you didn't even know existed or you didn't care about as much. Even things like preventing osteoporosis, preventing dementia, preventing heart disease. So there's a lot of advantages to addressing the hormonal component of this. There are a few things that I always ask my patients whenever we talk about sleep or the patients bring up a sleep concern. One is it a problem with sleep onset, falling asleep, or sleep maintenance, staying asleep? And that can then help guide the discussion, and because it kind of can help me to understand what could be going on here. And sometimes it's one thing and sometimes it's multiple things. So that's why there needs to be more of an extended back and forth with me asking the patient questions that help me to understand what the problem is so that I know how to fix the problem. I don't want to make it seem like hormones are the only thing that can solve these sleeping problems. They often are a piece of it, especially during this perimenopause and menopausal time of life. But we can't ignore sort of the really foundational things too, like diet, and exercise, and stress management, and even taking certain supplements, targeted supplements based on testing and symptoms. So let's start with diet. Blood sugar dysregulation is going to absolutely go hand in hand with hormone imbalance. So, hormones can both cause blood sugar dysregulation and kind of spike and crash, but also the reverse can be true. Blood sugar dysregulation can have a negative impact on the hormones as well. And when we think about hormones in this way, not only do I think about the sex hormones or their gonadal hormones, I also include cortisol in that, and that's actually a steroid hormone. But the cortisol is kind of our stimulating get up and go, fight or flight hormone. And when that is high, we're actually insulin resistant. So, in the way, stress, of course, impacts our blood sugar and our insulin management. So, you can start to see then how all these pieces of the puzzle come together and have a huge impact, and why we need to then say we can't just give hormones and do nothing else. If we do give hormones, I still talk to my patients about what can we be doing better with diet wise, exercise wise, stress wise. What supplements do we need to be on to make sure that we've got those foundational puzzle pieces in place? Certainly, if sleep has been an issue for you for any amount of time, you've probably already looked up the sleep hygiene tips. Dark room, cold room, don't be on screens before bedtime, don't eat or drink within a couple hours of bedtime. I do think that's a good one too. All these are good ones. But honestly, by the time people have come to me, they've almost always tried all of those things and they haven't been effective enough. And so that's when we need to get into the individualized testing and treatment so that we can help these people sleep. Even if you are a person who thinks that caffeine and alcohol do not affect your sleep, I can tell you almost without a doubt that they do. If you wear any kind of tracking device like an Aura ring or the Whoop strap, even the Apple Watches, some people are able to charge in the evening and wear overnight. That can really show you what impact alcohol, caffeine, even eating right before bed can have on your quality of sleep. So pay attention to those things. The way that I approach sleep problems is similar to the way that I approach any health problem, and that is with a functional or integrative medical approach. I want to know as much as I can about what's going on with that patient, not only regarding their sleep, but about their life stressors, about their bedroom environment, about what they're eating, about how they're moving, all these things, because again, they're all part of the puzzle, and the puzzle is not finished until we have all the pieces and all the pieces in place. So, if you've tried these initial things and you're still not sleeping well, you probably would do well to consult with a functional medicine nurse practitioner, doctor, somebody licensed who's able to order tests for you, prescribe if necessary for you, and really take a whole, well rounded approach. If you're curious about seeking health from me, Nourish House Calls, you can do that on our website. It's nourishhousecalls.com, where you can click the link and book a free 15-minute discovery call. I always want to make sure that we have a little bit of a connection before we sit down for our initial appointment.